You think you're protecting your large dog from parasites. What if the standard treatment is a danger to them? For breeds like collies and German shepherds, a common dewormer can cause severe neurological damage, or worse. The source is a gene mutation, MDR1. A drug like high-dose ivermectin becomes a significant threat. This isn't a minor side effect. A normal therapeutic dose can be fatal for a dog carrying this genetic flaw. This genetic risk is just one piece. We'll show you a superworm threat and the real strategy to keep your dog safe. First, a dangerous misconception. Many large dogs carry heavy parasite loads without showing any outward signs. Another myth, any dewormer from the shelf will work. In truth, drugs target specific parasites. One for roundworms may not affect tapeworms. For a 100-pound dog, the line between an effective dose and a toxic one is very thin. Precision is vital for safety. Over-the-counter dewormers often lack prescription strength, and their dosing instructions can be imprecise for giant breeds. So if you can't rely on visible signs or a generic product, how do you correctly select a dewormer? The answer starts with a diagnosis. A simple fecal test from your vet identifies the exact parasite you need to fight. Let's return to the MDR1 gene. Healthy dogs have a P-glycoprotein pump. It works like a bouncer, pushing certain drugs out of the brain. The MDR1 mutation creates a faulty pump. With the bouncer gone, drugs like ivermectin flood the brain to toxic, life-threatening levels. This is why owners of shepherds and collies must be cautious. Safe alternatives like fenbendazole don't rely on this broken pump. Ever notice a dog seems sick after deworming? It might be a parasite die-off reaction. Dying worms release toxins, upsetting their system. Underdosing is a huge mistake. A low dose kills weak worms, but lets the strongest survive to pass on their drug-resistant genes. We've discussed genetic dangers and dosing errors, but what happens if you use the right drug at the right dose and the worms survive? This is a real crisis. Multi-drug resistant hookworms. These superworms are resisting multiple classes of dewormers. This isn't happening in a lab. Resistance is being found nationwide, especially in dog parks and former greyhound kennels. The main offender is Ancylostoma caninum, a very common hookworm. A routine problem has become a major treatment challenge. So we have genetic risks making some drugs dangerous and resistance making others useless. The situation gets more complicated. A dewormer is not a shield. It kills parasites present today, but your dog can be reinfected from the environment tomorrow. The most baffling problem is reinfection from inside your dog's own body. It's a process called larval leakage. Here's how it functions. Some larvae hide in muscle tissue, dormant and shielded from medications that only work in the gut. After a deworming clears the gut, these dormant larvae can leak back into the intestines, starting a new infection from within. With all this, is the standard deworm every 3 months schedule still adequate? For high-exposure dogs, it may not be enough. We're facing genetic risks, drug resistance, and parasites hiding inside the body. Yet there is a strategy that addresses all this. What do you do when the correct drug fails? The solution isn't a new pill. It's a smarter, diagnostic-led approach. This makes fecal testing your most powerful weapon. A post-treatment test confirms if the drug worked or if you face resistance. The need for precise dosing, combined with the lethal risk of the MDR1 mutation, makes one thing clear. Veterinary guidance is mandatory. The modern strategy is a cycle. Test to identify the parasite, treat with a targeted drug, mindful of genetics, then test again to verify. Deworming your Great Dane or Mastiff is not the same as deworming a small dog. Their biology demands a more intelligent approach. Here is what you must do. 1. Know your dog's risk. Ask your vet about MDR1 testing for herding breeds. 2. Request a fecal test first. 3. Get an accurate current weight for dosing. And don't fall for natural cures for an active infection. They are not a substitute. Protecting your gentle giant means adopting a smarter, safer strategy. Partner with your vet and begin with a proper diagnosis.